So initially I had some skepticism about ELIXIR, but I have used it on my patients, and every single patient I have used it for has had fantastic result in 3 different specific areas of swelling, bruising, and overall healing much faster. With rhinoplasty, we see a lot of sometimes they have bruising around the eyes and swelling of the nose, and this is really helpful, especially the yellow light, because it has some specific properties that affects the cellular repair mechanism, helps patient recover faster. And you want to reduce the bacterial load preoperatively the day before. We utilize the blue light that also helps with decrease the bacterial load and promote healthy microflora of the skin. That also is very helpful. I think it's a good adjunct to helping patient recover faster and have better outcomes.